Good Saturday morning to everybody, and welcome to Hyperfit Radio Show with Dr. Charles and Francesca Guglin. I'm Gary Byron. Glad to have you on board. How's it going, gang?
We're good.
Hey, you look great.
Really busy.
How's your week been? Oh, yeah?
Yeah. I was in Kansas City last week.
Kansas City?
Yeah.
What were you doing out there?
Oh, barbecue. I don't know.
Oh, they've got great barbecue in
So I
Kansas
hear.
City.
I never
yes.
made it out of the hotel,
Aw.
but I was there taking an advanced course in dermal fillers.
Dermal fillers, which
dermal
is
fillers.
like
It's an aesthetic procedure, not like Botox, but it's kind of goes hand in hand with Botox for facial, aesthetic uses.
it's funny because I've heard Botox for years, and I think you could be a doctor that just specialized in Botox. You'd make a pretty good living. That's not just something that's done out in California. I mean, people get Botox everywhere, right?
Oh yeah, definitely.
Is it still as popular today? Has there been advances in Botox than yesteryear? Or?
Well, yeah, there's been advances. FDA has approved it for different uses on the face now, and especially during everybody's on Zoom now, and they're looking at their faces for the first time.
That's a great point.
Yeah, people especially guys. I look at my face once a day. I'm brushing my teeth and I'm shaving, and I never look at my face again. Now guys are looking at their own faces all day long, and women are looking at their own faces all day long, and and not to mention, right.
Am I getting a zit?
Yeah.
Really? What is that? Oh,
Plus,
man.
they also notice that the 30 other people on that Zoom call are also noticing that they have a zit on their chin, or that their eyelids are beginning to fade a little bit, that kind of thing. So,
Are there areas you can't get Botox? Can you get Botox everywhere? Like, can you get it on your neck? Can you get it on your hands? Can you get it?
There's really no uses for. For instance, it's useful for migraine headaches, anal fissure. Believe it or not, anal fissure is something that was always a surgical disease, a surgical problem. Now Botox, I'll spare you the whole details, but now Botox is used for the treatment of anal fissures. It's used for treatment for esophageal spasm, different GI issues, those kinds of things.
Wow.
Yeah, so the indications are expanding for the use of Botox. A lot of different spheres of use.
I had no idea that it was that widely used.
Yeah.
You do a lot of Botox in your office?
More and more, I think, yeah, definitely.
Age management
That's right.
falls under
Quality
that.
of life.
Yeah, certainly falls under that category.
Definitely.
Let's talk about peptides.
Okay.
Let's start with the most basic. All right, you can't talk about peptides unless we find out what exactly is a peptide.
What the heck are they, right?
Well, we've heard of them.
Yeah.
There's different types of peptides, though, right?
Oh, exactly.
Yeah.
Anybody who took biology in high school knows have heard about peptides, right? You know what a protein is, right? It's a string of amino acids. Okay, a protein is a string of amino acids that is greater than like 40 to 70 amino acids, because once that string of amino acids gets long enough, it starts to fold on itself and it becomes a three-dimensional object. Peptides are simply a shorter string of amino acids. Insulin is a peptide. Many things that we think of as hormones are actually peptides. And our body makes I once attended a lecture where the guy said that our body makes 37,000 different peptides for different uses. And there are many peptides that have found their way into the therapeutic realm for different specific problems. These are all, by the way, all the peptides we use in our office are all stuff that your body already makes. So they're not pharmaceuticals, and they're used for many different therapeutic uses. But in short, a peptide is a string of amino acids.
Coming from where?
We have them compounded for us. It's basically compounding pharmacies make them, and certain compounding pharmacies, you need to know where to get them. But they're made for us by compounding pharmacies.
Oh, so just to be clear, we don't make them in our own body.
Well, all the ones that we use we make in our own body, yeah. But they're not the ones that we use for therapeutic purposes. They're not extracted from other human beings. They're made. They're created on a bench. Basically.
Pharmaceuticals,
right? Well, I separate them from pharmaceuticals because, especially in the community that we work in, most of what we use are isomolecular products that our body already makes, which the pharmaceutical industry is not allowed to make and upsell. We talked about menopause and we talked about the hormones, bioidentical hormones in past talks, shows. And so I separate pharmaceuticals as being something that is made to treat a symptom, whereas most of what we do in our practice is utilize, most of it is isomolecular compounds that your body already makes that we use to treat an underlying cause of a symptom. So a little bit different.
Yeah, like what kind? What types of problems are they used for?
Let's see. There's one called BPC 157 that many people call the healing peptide. BPC 157 is a peptide that's present in your GI tract only when your GI tract is healing something. For instance, if somebody has an ulcer, an open ulcer in their stomach, you can find BPC 157 in the gastric juice of the stomach. It's not there any other time than when your body's healing something. People with Crohn's disease who have open wounds in their upper GI tract, or parts of their GI tract, you can find BPC 157 in the liquid in their GI tract then also. So we use BPC 157 in situations where people are in a gut are in gut healing mode or have gut issues that requires help with healing. And BPC 157 works great in a lot of different situations.
And there's so many people with Crohn's disease or irritable bowel syndrome, IBS.
Things like that. Leaky gut syndrome, which the
that?
allopathic community doesn't believe in, but the naturopathic community definitely believes in. Leaky gut syndrome, your GI tract is lined with cells that are designed to absorb micronutrients. And the way they absorb micronutrients is because there are very tight junctions between those cells. They're called tight junctions. Many of the things that we eat, soy in particular, gluten, many of the things that we eat or that we're exposed to in our environment cause those leaky junctions to open up. And so then rather than consuming and then absorbing only micronutrients, we have macronutrients leaking into our bloodstream. Many people think that leaky gut is one of the progenitors of many autoimmune disorders because what is an autoimmune disorder? It's when your own immune system is attacking a part of your body because it confuses it with something that's been exposed to. A gluten enteropathy, which we all know of as celiac disease, is our own immune system, which has been sensitized to gluten metabolites, attacks our GI tract because it's confusing our GI components of our GI tract with those gluten metabolites. Our immune system, in theory, would not be sensitized to those macromolecules had it not been exposed to those macromolecules. So many people think that this is one of the things that comes from leaky gut. So it's just one thing that it's just one component of the use of this particular peptide.
I hear more and more about autoimmune disease.
Sure.
I know it's been around for a long time, but why is it maybe over the last 10 or 15 years where it's become more prevalent? Is it environmental? Is it a part of is it the foods that we eat? Is it hereditary? Because if it's hereditary, there are people whose parents and family members didn't exactly have it years ago, What is it about today over the last, or at least over the last 10 or 15 years that makes, it creates autoimmune disease?
Good question. All of the above. The answer is all of the above.
Is it really?
I have one patient who has everybody in his family has lupus. Who knows why everybody? His mom has it, he has it, his sister has it. That may be a hereditary component or maybe something they were exposed to environmentally when they were younger. To go back to this leaky gut syndrome, many people think that that's a progenitor of many autoimmune diseases. We're exposed to the byproducts of plastics. Okay, plastics are everywhere in our environment. Right. Francesca won't let me microwave something in a plastic thing because the theory is you're exposed to the destruction of parts of that plastic you're exposed to if you eat the food that comes from that. The phytoestrogens, the phytohormones that are in many of the foods that we eat, the hormones that are in beef, the anabolic steroids that are in many of a lot of the protein that we eat, stuff like that. The theories abound about why there is literally an epidemic in autoimmune disorders in this world. I don't have an answer for you.
Yeah, I was going to.
It's all of the above.
The next thing I was going to say is when you have one of these autoimmune diseases, and there's a variety of them, I take, right?
Sure,
There's many different types of them. Yeah. What I'm trying to think how I want to ask this. Not just what can be done, because it would probably depend on what kind of autoimmune disease you have. Yeah. Is it as simple though as just staying away from gluten or certain away from soy or just staying away? Is it that simple? Just hey, well then just stay away from this because this will trigger this and that'll have an effect on it, or it's that simple. Just stay away from.
Sometimes it's that simple. If you have a gluten enteropathy, if you have celiac disease, then staying away from gluten doesn't cure the problem, but it makes it so that you can eat without being sick. You'll always now. Certain autoimmune disorders seem to burn out as a person gets older.
Oh, really?
Well, yeah.
It's a young person's disease, then.
Celiac disease, not necessarily. I'm just saying it seems to sometimes.
No, an autoimmune disease.
Yeah, it's an autoimmune disease. And sometimes they seem to burn out or become less symptomatic over time. But much of the treatment of autoimmune disorders have to do with treating the symptoms. There's not much that you can do. Hashimoto's thyroiditis, okay, is an autoimmune disorder where your own immune system attacks your thyroid. It's one of the principal causes of hypothyroidism in the Western world. Okay, it's an autoimmune disorder where your own immune system attacks attacks components of your thyroid and makes you hypothyroid. The treatment for that thyroiditis is giving a person thyroid because they will always have. Once they start making antibodies, they'll always make antibodies to their thyroid tissue. So
is this an overactive thyroid? Is that what it is? Or?
That's Graves' disease. No, Hashimoto's thyroiditis is basically an underactive thyroid.
Oh, yeah. Underactive.
Yeah.
Boy, that thyroid. Either overactive or underactive.
The freaking thyroid.
A lot of women have thyroid issues, right?
Oh, definitely. Yeah.
Why do more women have that than men?
Good question. I'm not sure that that's the case, but I think it is the case, but I have no idea why. Yeah.
Well, let's go back to peptides. Where do you get them?
Well, first of all, let's talk more about the use of peptides because it's important for people to know that they are useful for a lot of different things. For instance, we have a lot of the average person who comes in who's postandropausal or postmenopausal complains of sleep problems. Okay, basically the most common complaint that we hear is, Doc, I fall asleep just fine, but I wake up around 2 o'clock or 4 o'clock and I just can't get back to sleep. Okay. We get them on a program of getting off their computer before they go to bed and making sure the lights are low and so on and so forth, making sure they're reading from a paper book if they have to read before they go to bed, stuff like that. Then we get them on the appropriate doses of melatonin. And if they're still having problems with that, then we use a peptide called BPC 157, CJC 1295, and that usually comes with another one called ipamorelin. These are what are called secretagogues. These are very cool peptides. Rather than giving a person growth hormone, which is an exogenous growth hormone, that everything in the endocrine system is a feedback loop. If you give somebody growth hormone, it basically turns off the hypothalamus, that part of the hypothalamic feedback loop. If you give them certain peptides, they're called secretagogues, they basically stimulate your hypothalamus to make your own growth hormone. So they give themselves this CJC 1295 just before they go to bed, and it incites a spurt of growth hormone about half an hour after they fall asleep, and it knocks them out, and they're asleep all night long. And it is physiologic sleep, okay? It's not ambient sleep. It's not Benadryl sleep.
Yeah, I was going to say, It's not like taking, what is that, Z's? Or
any of that stuff, yeah. Basically, you wake up feeling refreshed because it's physiologic sleep. That's why you can throw a hand grenade into a baby's room and they don't wake up. It's because they have a huge spike of growth hormone between like 2 a.m. and 6 a.m. Plus, since you're giving them a secretagogue that causes that spike in growth hormone, it helps them burn belly fat and helps them to build muscle also. So there's kind of a side effect that's really great about that one.
This may be a little unrelated, to our general topic, but it's talking about sleep or sleep deprivation or lack of sleep. Is there any truth to the myth that the older you get, the less sleep you need, and that the lighter you sleep?
The first one is no, there's no truth to it. We all need 6 to 8 hours of sleep a night. It's very important. Your entire immune system, your entire endocrine system resets. Yeah, 6 to 8. Yeah. Yeah, swallow that one.
I can't.
Swallow that pill.
5 hours a night.
Yeah.
I go to bed at 11. I get up at 4.
Yeah.
Monday through
but
Friday.
that's job related.
Yeah.
It's job related. Look, we all went through when we were in school. We could all sleep until noon or 1 o'clock. Okay, I mean, we could go to bed at 11 and literally sleep for 12 hours. All right, that's physiologic sleep. We need that sleep. And one of the things that we work with a lot in our practice is getting people to sleep, having them reorganize their schedule so they get enough sleep. Because what does everybody complain of? They complain of being tired, right? I'm tired all day. Every time I stop moving, I fall asleep. Yada, yada. We hear that all day long. And so part of it, yeah, right. So you're yawning.
You're talking about it.
Right.
It's like, you ever see somebody yawn, and what do you do 5 seconds later? You yawn yourself. We're talking about sleep.
Yeah, so we're putting you to sleep by talking
No,
about sleep.
because I wasn't yawning at all throughout the show. You start talking about it. It's like, all right, well,
But yeah. And I think probably we do sleep lighter as we get older. Yeah. I mean, we've all been, part of it is you get older, you become responsible for a space. You're responsible for your home, okay? Mm-hmm. You've had the electricity go off in the middle of the night when you're sound asleep, and bam, you wake up just like that, okay? The refrigerator, the sounds that engulf you when you're in your own home, if something changes, that's going to wake you up, just like that, because you're sleeping a little bit lighter, you're more prone to be conscious of things going on in your environment. Because you're responsible for that environment. Okay, mm-hmm. Your kids, you've got babies across the hall. They burp sideways, and you're awake. You're awake like a shot. So that's part of it. But I think we do sleep lighter as we get older, and it has to do with hormonal issues and creaky joints and having to go to the bathroom and all sorts of things. So
interesting. Yeah. I didn't know if that was a myth or. Since we were talking about it, I figured I might as well.
Definitely need sleep. We all need sleep.
Well, no, I know we all need sleep, but I'm trying to think where I've heard. Maybe I've heard it in many different sources that the older you get, the less sleep you need, and that when you do sleep, you're a real light sleeper, where you hear a car door outside and what was that? What was waking me up? What's going on here?
Well, I agree with the latter, but certainly not with the former.
Yeah. Folks, you are listening to HyperFit Radio Show. Dr. Charles Guglin, Francesca Guglin as well. I'm Gary Byron. Are there any dangers involved in using these peptides at all, or
no.
Are there side effects even, or?
No, actually, that's what's cool about them is you are just giving somebody something that their body already makes. The only side effects is, I think part of the issue is they are not. We're used to pharmaceuticals. Okay, we're used to taking a pill and something about our body changing. Okay, you take a pill and your headache feels a little bit better. You take Ambien and you sleep like a log. Okay, we're used to taking pharmaceuticals and having something change that we can recognize. Yeah. The changes that occur with peptide therapies are much more subtle, and they occur over time.
Well, it seems like the way you were describing that, it feels a lot more natural, particularly when you wake up. Because you're right. When you take one of those over-the-counter, medicines to help you sleep.
Yeah, they knock me out. I can't take those. Yeah.
Well, yeah, but when you do wake up,
you're drowsy.
Yeah. You don't feel like you really had a good, right, exactly. You don't feel like you had a good night's sleep. And it's almost like, I know I slept, but I feel different than a natural sleep.
Yeah. Yeah, you're drowsy and you're stupid. I mean, I am. My brain just doesn't work for me when I take those things.
What is it that keeps people? Is it just stress? Is it stress when you just can't sleep? Is that age related? Is that age management? And when somebody comes to you and says, "I'm having a hard time sleeping," or you referred to it, I think you've done this a couple of times, where you'll have a patient that says, I fall asleep and then I get up at 2:00 in the morning and I can't fall back to sleep. But what do you say to the person then who just has a hard time falling asleep every night? Period.
Oh God, we do everything from training them in mindfulness techniques. We do a lot of work with that sort of thing. We do blood work to make sure there isn't something going on. To make sure they don't have Graves' disease or some other problem that's making it difficult for them. Postmenopausal women, we hear that, especially right after menopause or in perimenopause, we hear that all the time. And a lot of the time that has to do with hot flashes and night sweats and those kinds of things, which can be treated. So it depends on your pattern of lack of sleep, I guess.
Stress level,
Oh my God,
and
stress is the leading cause of difficulty sleeping, which is why we talk about mindfulness techniques all the time. We try to teach people. How to meditate and how to use the skill of practicing meditation to help them get to sleep under those circumstances when they're having difficulty getting to sleep. Because a lot of times it's just that your brain is swirling; it's going in circles. You know?
So is it age related?
I guess, yeah, it's age related, but we see younger people with the same problem. A lot of it depends on how you respond to stress. Okay, as Americans, we're trained to internalize stress. We're supposed to swallow. Remember, we talked about that bag the other day. Okay, we're just taught to swallow stress, and it virtually always manifests itself in some somatic issue, whether it makes your back pain worse or whether it makes you difficult sleeping. There's always a somatic price that you pay for swallowing your stress. I believe it anyway.
Going back to peptides, how do you utilize peptides in HyperFit MD?
It depends on what a person's complaint is. It's not something that we go right to. Frankly, it's something that we introduce them to. We introduce them to the concept of it. Try alternative ways of helping them with their problem. But frequently, there are problems that suggest peptides right away. We were talking about the GI issues before. There's a peptide called dihexa, which crosses the blood-brain barrier and is very helpful with short-term memory issues. So we have several patients who are kind of older, having memory issues, having difficulty, especially with memory, and this is fairly helpful with those people.
Wow.
Levels, right? Yeah.
What was that?
IGF. We were talking about the secretagogues before. IGF, insulin-like growth factor, which is how we measure growth hormone in the serum. We can watch that rise when we put people on these secretagogues. There's another one called thymosin alpha, which increases the level of killer T cells in your body. So basically, hyper charges your immune system. So it's very helpful in that regard.
I would imagine you'd put a lot of fear to rest when some people are suffering from short-term memory loss and they're thinking, "Oh no, please don't tell me I'm already getting the onset of Alzheimer's or the early onset of a form of dementia or whatnot." And it sounds like a lot of people would quick to go down that road, where they come and see you and you can say it's anything but, and you can sometimes we hope
it is what it is,
right?
And you're just trying to help them with it, and it gives them something that they're pursuing that can help with the problem. It's not a miracle. It doesn't make the memory come back, but it is very helpful in those circumstances.
But there's a genetic test to see if you have a gene for Alzheimer's.
Yes, we do. Some of the genetic testing
a test that you perform at HyperFit.
Well, yeah, we take the blood and then somebody else performs it.
Well, yeah, you're right. You send it to a lab and
yes.
Right?
There's genetic testing that can look at your risk for Alzheimer's disease. Yeah,
I didn't know that.
Disease.
Yeah.
What was that?
And heart disease.
Oh, and heart disease. See,
maybe,
the thing.
Maybe you don't want to know.
well, that's an interesting perspective as well. Do you really want to know?
It is.
I
Yeah.
think so.
You would change your
want
life,
to
right?
know, Yeah.
Yeah.
Could change-
Inflammation. You can help stuff slow down.
But that's what this is all about. It's being preventative.
Right.
Where if you knew that, you could control something, if you knew ahead of time that life didn't have to be this way, your body didn't have to be this way, you didn't have to react this way. If you knew ahead of time, if you knew something in advance to prevent X from happening, wouldn't you do everything impossible?
I would.
Providing the X is a terrible thing? Yeah.
I would.
Yeah.
Well, yeah, and that's the reason why HyperFit MD exists.
Well, I mean, you say to a person, look, this genetic marker for Alzheimer's disease exists in your genetic makeup. There are things that you can do to help you with that risk, and virtually all of it is lifestyle. Is changing your lifestyle. Virtually all of it is, exercising, eating cleanly, getting rid of belly fat, all that other business. That's what you're trying to do, is optimize a person's health so that they can do an end run around this genetic risk.
You talk about lifestyle changes, which can be easier said than done for a lot of people, particularly when they've been set in their ways. And a lot of people know what I'm talking about here.
Yeah.
it's also generational, right? I think there's more. We're more, I guess, exposed to comfort foods and fast foods. And
Oh yeah.
we're living a fast-paced lifestyle. I got to get there. I got no time to eat. Oh man, I got 20 minutes. Where am I going to go and sit down and eat a meal for 20 minutes?
Right.
I can go through the drive-through,
Yep.
sit in the parking lot, or drive while I'm wolfing down a sandwich or a burger.
Well, it's or the sugar-filled protein bar that you have in your purse, that kind of thing too.
Yeah, people don't
Quick
remember
foods.
it's sugar. It's
Quick
in
foods. Yeah, huh?
there. You got to remember it's sugar that's in there.
That's right. Exactly.
Really, it's great info, Doc. It really is. Again, one of the beauties of this show, folks. If you've got a question for Dr. Charles Guglin, and you'd like to have it asked right on, in fact, not only on this radio show, but maybe, who knows, it could be next week. This is what I'd like you to do. I'd like you to email this show at hyperfitradio.com. Hyperfitradio.com. Who knows? Could be your question that we ask 1 week from now. I got to tell you, if you're looking for more information on peptides or anything that has to do with age management, there's one site and one site only that I want to direct you to. Hyperfitmd.com. Hyperfitmd.com. As a matter of fact, it will more than likely answer the questions that prompted you to even go to the website in the first place. But it may also do something else. It may also add a couple of questions to your list. All the more reason for you to make the phone call. Contact Dr. Charles Guglin himself. He's happy to answer your questions. And by the way, you can email him if you'd like. I'll give you 2 ways that you can contact him. cguglinmd at hyperfitmd.com. I'll repeat that. cguglin, Guglin, MD at hyperfitmd.com, or give him a buzz the old-fashioned way. This is what I would do. I would just give you a call.
Sure.
Area code 203-890-9777. Once again, 203-890-9777. I can't stress enough, though, hyperfitmd.com and how key that is. It's an important website for you to check out. For Dr. Charles Guglin, for Francesca Guglin, I'm Gary Byron. Thank you so much for listening. Until next week, everybody, have a good one. So long.